You do not have to eliminate carbohydrates to fix your blood sugar. I want you to stay with that statement for a moment, because if you have been managing blood sugar for any length of time, you have almost certainly been given the opposite impression. Cut the carbs, avoid the bread, skip the rice, eat less of everything you enjoy, and more of everything you find difficult to sustain. That approach works for some people in the short term, but the patients I have seen manage their blood sugar most successfully over months and years are not the ones following the most restrictive protocols. They are the ones who understood something more precise than simply what to remove. They understood what to add and why adding the right foods changes what is happening at the cellular level in ways that restriction alone cannot achieve. Today I am going to walk you through 10 specific foods, what each one does inside your body, at the level of insulin signaling and glucose metabolism, and exactly how to use each one. Not as a temporary intervention, as a sustainable daily pattern that your body can maintain, because it is built around addition rather than deprivation. My name is Dr. Reina Sato. I am a preventive medicine physician and longevity researcher, and the cellular mechanisms driving insulin resistance are an area where the gap between what patients are told in a standard appointment and what the current evidence actually supports remains wider than it should be. A 12-minute clinical visit cannot explain how food communicates directly with your insulin receptors. Today I am going to. Before we continue, one essential clinical note. Everything I am sharing today is based on peer-reviewed research and represents general educational information. I am not your physician. If you are currently on insulin or blood sugar-lowering medications, please discuss any dietary changes with your managing physician before implementing them. Several of the foods I am about to describe can lower post-meal and fasting glucose meaningfully, and if your medications are calibrated to your current dietary pattern, improvements in blood sugar from these additions may require a medication adjustment that should happen under clinical supervision, not independently. Bring this information to your next appointment and have that conversation with the physician who knows your complete health picture. Now, what is actually happening upstream of the blood sugar numbers your meter shows you? High blood sugar in type 2 diabetes and prediabetes almost always begins with a hormone called insulin. Insulin functions as the signal that unlocks your cells, allowing glucose to move from the bloodstream into the tissue where it can be used as fuel. When you have spent years riding the blood sugar roller coaster, your cells progressively stop responding to that signal. Insulin knocks. The cell does not answer. Your pancreas compensates by producing more insulin. Blood sugar climbs anyway, because the problem is not the quantity of insulin. It is the responsiveness of the cell to insulin's signal. This condition is called insulin resistance. And the standard pharmaceutical response, adding more insulin or medications that push more insulin into a system that is already producing more than it should, addresses the output of the problem without addressing the upstream cause. The 10 foods I am about to describe each perform one of 3 specific jobs. Some slow the rate at which glucose enters the bloodstream, preventing the surge that triggers the pancreatic panic response. Some reduce the chronic inflammation that is physically interfering with insulin receptor function at the cellular membrane. And some directly improve insulin receptor sensitivity, helping your own cells answer the insulin signal more efficiently. You do not need to implement all 10 simultaneously. Add them progressively over the next 2 weeks. The effect compounds as more of these mechanisms operate together. The first is fenugreek seeds. These small amber-colored seeds are available in the spice aisle of most grocery stores for a few dollars. If you pass them by because they sound unfamiliar, you are walking past one of the most well-documented blood sugar tools available at that price point. The active mechanism is a soluble fiber called galactomannan. When fenugreek seed meets the water in your stomach, it swells into a thick gel that physically slows the rate at which your stomach empties carbohydrates into the small intestine. Slower gastric emptying means glucose enters the bloodstream gradually, rather than in a surge. No flood, no sharp spike, no large compensatory insulin dump from the pancreas. Beyond the fiber mechanism, fenugreek contains an amino acid called 4-hydroxyisoleucine that nudges the pancreas to release insulin more efficiently and supports glucose uptake into muscle cells through a separate pathway. To use it, soak 1 teaspoon of whole seeds in a glass of water overnight. In the morning, drink the water and eat the softened seeds before breakfast. If the slightly bitter flavor is difficult, grind the seeds and stir half a teaspoon into yogurt or mix it into eggs. Begin with a small amount and increase gradually. The fiber is potent, and the gastrointestinal system needs several days to adjust. The second is Ceylon cinnamon. You almost certainly have cinnamon in your kitchen, but the variety matters more than most people know. The common grocery store cinnamon is cassia cinnamon, which contains a compound called coumarin that places stress on the liver at the daily doses needed for blood sugar benefit. The variety you want is Ceylon cinnamon, sometimes labeled true cinnamon. It is milder, it is safer for daily use, and it is the form used in the research that produced clinically meaningful results. The mechanism involves a group of polyphenols that behave similarly to insulin at the receptor level. They improve the ability of insulin receptors to grip and respond to insulin signal, and they independently slow gastric emptying after a meal. Research from the Human Nutrition Program at the USDA found that under half a teaspoon daily produced measurable reductions in fasting glucose in adults with type 2 diabetes. Use 1/4 to 1/2 teaspoon of Ceylon cinnamon daily. Stir it into oatmeal, coffee, or a smoothie. The most effective timing is paired with a carbohydrate-containing meal, which is precisely the moment when improved receptor sensitivity and slowed gastric emptying are most useful. The third is broccoli sprouts, and I want you to give this one your full attention because it is the most underutilized food in this entire discussion. Not mature broccoli, the 3-day-old sprouts. The distinction is not cosmetic. Broccoli sprouts contain between 50 and 100 times more of the active compound than a mature head of broccoli. The compound is called sulforaphane, and it does something that no other food on this list does quite as directly. It goes to the liver and reduces overnight glucose production. Your liver synthesizes glucose while you sleep. In insulin resistance, this process becomes dysregulated and produces far more glucose than your body needs, which is why so many people with type 2 diabetes wake up with elevated fasting numbers despite not having eaten for 8 or more hours. The elevated morning reading is not from last night's dinner. It is from your liver working overnight without appropriate restraint. A 2017 study from Lund University in Sweden gave concentrated sulforaphane to people with type 2 diabetes and produced measurable reductions in fasting blood glucose. The effect was most pronounced in participants whose fasting numbers had been most resistant to improvement by other means. A small handful, approximately 1/4 cup of raw broccoli sprouts, added to a salad or sandwich most days provides a meaningful dose. Do not cook them at high heat. The enzyme that activates sulforaphane is heat sensitive. Eat them raw or very lightly warmed. The fourth is avocado. The instinct to avoid avocado because of its fat and calorie content is costing people one of the most blood sugar-friendly foods available. The fat in avocado is predominantly monounsaturated, the same family as olive oil, and its metabolic effect is the opposite of what the word fat implies for blood sugar management. When you add half an avocado to a meal that contains rice, bread, or any starchy food, you are not removing the carbohydrate. You are placing a biological brake on how quickly that carbohydrate converts to blood sugar. The combination of monounsaturated fat and fiber in avocado slows gastric emptying, extends the window over which glucose enters the bloodstream, and flattens the post-meal curve that would otherwise spike and crash. Over time, monounsaturated fat intake has been associated with improvements in insulin sensitivity in peripheral tissues, meaning the cells begin responding more readily to insulin signal. Half an avocado daily is a practical and evidence-supported amount. Add it to eggs in the morning, spread it on whole grain toast, or incorporate it into a salad that includes a starchy component. Wherever a carbohydrate appears in your meal, avocado alongside it softens the glucose response. The fifth is chia seeds. These small seeds are one of the most concentrated sources of soluble fiber available in the food supply. If you have ever seen chia sit in liquid and transform into a gel, you have observed exactly what it does in your digestive system. That gel wraps around carbohydrates in the meal and slows their absorption substantially. Glucose is released slowly and steadily rather than in a surge, which prevents both the sharp post-meal spike and the crash that follows it. Chia also also provides plant-based omega-3 fatty acids that reduce the chronic low-grade inflammation that is one of the primary mechanisms keeping cells resistant to insulin signal. Cool that inflammatory environment, and the cellular membrane that houses the insulin receptor becomes more functional. 1 to 2 tablespoons daily is the appropriate amount. Stir into yogurt, add to a glass of water with lemon, or blend into a smoothie. Allow 10 minutes for the gel to form before drinking and maintain adequate fluid intake throughout the day, because the fiber requires water to move through the digestive system without causing discomfort. The 6th is fatty fish, specifically salmon and mackerel. This food works differently from the ones described above. It does not slow glucose absorption or buffer a meal. It addresses the deeper upstream problem, the reason the cells became resistant to insulin in the first place. Insulin resistance is driven significantly by chronic systemic inflammation. When the body is quietly inflamed over months and years, that inflammatory environment physically interferes with the insulin signaling cascade at the surface of the cell. The receptor is present. The insulin is present. The inflammatory interference prevents the signal from completing. Salmon and mackerel are among the richest dietary sources of EPA and DHA, the long-chain omega-3 fatty acids with the most direct and well-documented anti-inflammatory effects in the body. They reduce the inflammatory signaling that is jamming the insulin receptor. As that inflammatory burden decreases, cellular membrane health improves and the receptor begins functioning more as it was designed to. 2 servings per week, each approximately the size of your palm, is the target the research supports. Wild salmon, mackerel, sardines, and herring are all appropriate sources. Canned mackerel and sardines are among the most affordable and nutritionally dense foods in this entire list and deserve more attention than they typically receive. The 7th is walnuts. Among the nuts with evidence for blood sugar management, walnuts occupy a specific position because of what they do for the vascular environment that blood sugar management depends on. Walnuts are rich in polyunsaturated fat and plant-based omega-3s that improve endothelial function, the health of the thin cellular lining inside your blood vessels. Sustained elevated blood sugar is one of the primary sources of endothelial damage, and the damage to that lining is where many of the long-term complications of diabetes originate. Protecting that lining through dietary means is meaningful preventive work. Simultaneously, the combination of fat, fiber, and protein in walnuts blunts post-meal glucose response and has been shown to lower fasting insulin, which is the number that tells you how hard your pancreas is straining to compensate for insulin resistance. A small handful, approximately 1/4 cup or 7 to 10 whole walnuts, used to replace a processed snack rather than added on top of existing food, converts a blood sugar elevating habit into a blood sugar stabilizing one. Choose raw or dry roasted without added coatings or sugar. The 8th is whole eggs. For years, patients were advised to avoid egg yolks based on concern about dietary cholesterol and cardiovascular risk. That advice pushed many people toward high-carbohydrate breakfast alternatives that produced precisely the blood sugar dysregulation we are discussing today. The research has substantially revised the position on dietary cholesterol from eggs, and the blood sugar case for whole eggs is strong. A whole egg contains almost no carbohydrate, which means it produces essentially no direct blood sugar elevation. But the more significant benefit is what researchers call the second meal effect. Starting the day with whole eggs rather than cereal or toast stabilizes blood sugar not just at breakfast but through the remainder of the morning. The post-lunch glucose response is measurably lower in people who began the day with a protein and fat-dominant breakfast compared to those who began with rapidly digestible carbohydrate. The protein and fat also sustain satiety through the morning in ways that carbohydrate-dominant breakfasts do not, which eliminates the mid-morning hunger that drives snacking and produces the secondary glucose spikes that accumulate across a day. 2 to 3 whole eggs in the morning is a practical starting point. Scramble them, prepare them in advance for the week, or fold in leafy greens. Adding the avocado discussed earlier produces a breakfast with an exceptionally favorable blood sugar profile for the entire day that follows. The ninth is apple cider vinegar, and this is the food on this list with the most immediately visible effect for someone monitoring their glucose at home. The active component is acetic acid. It operates through two simultaneous mechanisms. It slows gastric emptying, moderating the rate at which carbohydrates from the meal enter the bloodstream, and it improves muscle tissue uptake of glucose through pathways that are partially independent of insulin signaling. Research led by Dr. Carol Johnston at Arizona State University found that 1 tablespoon of vinegar consumed before a carbohydrate-containing meal reduced the post-meal glucose spike by approximately 20 to 30% in people with insulin resistance. That is a clinically meaningful reduction from something that costs a few dollars per bottle. 1 tablespoon diluted in a full glass of water, consumed 10 to 15 minutes before a meal that contains carbohydrates, is the protocol. Always dilute. Undiluted acetic acid is hard on tooth enamel and the esophageal lining. If you are on blood sugar medications, discuss this addition with your physician before beginning, because the combined effect of the vinegar and the medication may lower glucose more rapidly than your current dose accounts for. The 10th is lentils, and this food makes the central argument of this entire discussion more clearly than anything else on the list. Lentils are a carbohydrate. They will lower your blood sugar. The explanation for that apparent contradiction is in their structure. Lentils are built from resistant starch wrapped in soluble fiber alongside a meaningful amount of plant protein. That structural combination means the glucose inside a lentil is released into the bloodstream slowly and steadily over hours rather than in a surge. The glycemic index of lentils is among the lowest of any carbohydrate source in the food supply, and they carry a second meal effect similar to eggs. A serving of lentils at lunch produces measurably better blood sugar control at dinner, even when the dinner itself contains no lentils, because the resistant starch and fiber have modulated the entire afternoon's metabolic environment. Half a cup to a cup of cooked lentils several times per week, used in place of white rice or white potatoes, is one of the most reliable single dietary substitutions for improving 3-month average blood sugar. Use them in soups, stews, or cold salads with olive oil and a splash of the vinegar discussed above. I want to tell you about a patient I will call Donna, 63 years old, recently retired. She came to see me frightened because her fasting glucose had been sitting around 180, and her physician had told her it was time to add a second medication. She had watched her mother lose toes and then her vision to this same disease. She did not want to spend the rest of her life climbing the medication ladder, and she wanted to understand whether anything she did in her kitchen could change the trajectory she was on. We did not cut her carbohydrates to nothing. We added eggs and avocado in the morning in place of the cereal she had been eating, a tablespoon of apple cider vinegar diluted in water before her larger meals, lentils in place of white rice several times per week, walnuts replacing the afternoon crackers she had been reaching for, fatty fish twice a week for dinner, Ceylon cinnamon in her morning coffee, broccoli sprouts on her lunch sandwich, chia seeds stirred into her afternoon yogurt. Within the first week, her fasting numbers began declining. Within 3 months, working alongside her own physician who was monitoring her response and adjusting her medication accordingly, she had reduced 1 medication and her HbA1c had moved from the diabetic range toward the pre-diabetic threshold. 2 years later, those numbers have held. She did not achieve that by eating less of everything she enjoyed. She achieved it by understanding what each of these foods was doing at the cellular level and making them consistent features of a life she could actually sustain. Here is why these 10 foods work when restriction alone fails. Every one of them is addressing insulin resistance through one of its actual upstream mechanisms, rather than simply managing its downstream symptoms. The fiber foods slow glucose delivery, so the pancreas never needs to produce the large compensatory insulin surge that exhausts its capacity over time. The omega-3 rich foods, the fish and the chia and the walnuts, reduce the chronic inflammation that is physically blocking the insulin receptor from receiving its signal. The cinnamon and the vinegar improve the receptor's ability to grip and respond to insulin directly. The eggs and the lentils reshape the metabolic environment for hours beyond the meal itself. Address those mechanisms consistently, meal after meal, day after day, and the cells that stopped answering the door gradually begin opening it again. That is what correcting insulin resistance means at a cellular level. And when it happens through sustained dietary change, rather than acute pharmacological intervention, the body holds the improvement because the inputs that produced it are still present. Here is where to begin tonight. Tomorrow morning, replace your cereal or toast with 2 to 3 whole eggs and half an avocado. That single substitution changes your blood sugar pattern for the entire day that follows. Tonight, soak 1 teaspoon of fenugreek seeds in a glass of water and drink it with the softened seeds first thing tomorrow morning before breakfast. This week, purchase Ceylon cinnamon and begin a 1/4 teaspoon daily in your coffee or oatmeal. Before your largest carbohydrate meal tomorrow, take 1 tablespoon of apple cider vinegar diluted in a full glass of water 15 minutes beforehand. This week, substitute lentils for white rice or white potatoes at least twice and add fatty fish to the menu 2 evenings. Add the remaining foods progressively over the following 2 weeks. You are not removing the foods that make your meals meaningful. You are adding the foods that protect the metabolic system that allows you to enjoy them. One clear clinical boundary before we close. If you are on insulin or a sulfonylurea, these foods can lower your blood sugar meaningfully and relatively quickly. Your medication dose may need downward adjustment as your body responds. Do not make that adjustment on your own. Bring this list to your next appointment, share what you are adding, and allow your physician to monitor your numbers and walk your dose down in response to genuine improvement. That is the appropriate sequence. The goal is better health under clinical supervision, not medication changes made independently. Your body has not failed at managing blood sugar. It has been given inputs that were working against its insulin signaling system rather than supporting it. Change the inputs consistently and the system responds. I am Dr. Reina Sato. If this gave you a more complete picture of what drives insulin resistance and how specific foods address it at a cellular level, share it with someone who has been told only what to remove from her plate without being told what to add and why it matters. The most sustainable path to better blood sugar is not the most restrictive one. It is the most informed one. I will see you in the next one.